Healthy choices, helping you live healthier. Sponsored by Intermountain Health.
And welcome back to Good Things Utah, everybody. Intermountain Primary Children's Hospital is leading the way in caring for life-threatening fetal conditions. And joining us now for this sponsored interview is pediatric surgeon Dr. Katie Russell and Kelsey Peterson. Thank you both for being on the show today. Doctor, let's start with you. We're talking about CDH. What is that condition?
So CDH is a condition where babies are born with a hole in their diaphragm. So the diaphragm separates the chest from the abdomen. So if there's a hole there, all the intestines and things that are supposed to be in the abdomen go up into the baby's chest. And that can be a life-threatening problem unless we go ahead and fix it.
So it stunts development? Is that one of the issues?
It does. It stunts the lung development and also all the vessels in the chest. They're all very small, which makes it difficult for the baby to breathe and also for the heart to function properly.
How common is something like that?
It's pretty uncommon. In Utah, we see about 30 babies a year that have this that we take care of at Primary Children's Hospital.
And you are doing more work there at Primary Children's than a lot of places in the country, and now there is an expansion. Kelsey, let's bring you into the conversation. Tell me about the outpatient clinic.
So the outpatient clinic is really nice because these kids need a lot of specialty care and a lot of follow-up care, and so we try to bring all the specialists into one area. And so we have kids come for follow-up from the time that they leave the NICU until they're 18 years old. They're seeing multiple doctors as well as nutritionists and occupational therapy, and so we try to get it all in one place for them to make it easier for our families, especially because a lot of them are traveling from so far.
Dr. Russell, is the surgery done on this while the baby is in the womb, or after, or both?
So typically after, we really have 3 phases of care. So the first care is when they are in the womb and we see them in our fetal center, and that's when we make the plan of care. Then they're an inpatient, and that's when we do the surgery. We do the surgery approximately a week or less after they're born. And then we have this awesome inpatient team. We're actually the 5th busiest center in the country, and we have the lowest mortality rate. And a lot of that credit goes to our neonatologists who have developed a new protocol. And then once we eventually get them out of the ICU, the neonatal ICU, then that's where they see us in clinic.
Now, congratulations. That is definitely a statistic to be proud of, one of the lowest mortality rates in the country. So you attribute your success at Primary Children's to what, would you say?
I think our team approach. You know, we all work together in the fetal center, then as the inpatient team, and now, thanks to Kelsey and our pulmonary hypoplasia program, we've brought everybody under the same roof to take care of them once they're out of the hospital.
Kelsey, what's new about this approach to this outpatient center?
I think the fact that we bring everyone to the patient. So we have cardiologists, heart doctors, we have pulmonologists, lung doctors, as well as Katie with our general surgery team and a few other general surgeons. And then them seeing nutritionists and occupational therapy. There's really every single aspect that the patient could need afterwards. We bring it all to them to answer their questions and help with whatever might come up.
We're all learning something today about CDH, which stands for?
Congenital diaphragmatic hernia.
Hernia, okay. And this is something that is a lifelong health battle for these kids?
It can be. It can be, and they are going to need a lot of follow-up, and there's different problems that may arise as they get older just with their development and having those smaller lungs, but we bring the care to them to make sure that we're there for every step of the way to figure out what they need and help them get through it.
Ladies, what is the reaction from patients when they have this kind of care and this kind of follow-up treatment?
I think they love it.
I think so.
You know, historically, they would have to go see 4 or 5 different doctors, you know, on different days, and now we all come together.
Which is so nice to have a team approach when it comes to any sort of health issue. This is happening at Intermountain Primary Children's Hospital, everybody. If you would like more information, as always, please go to our website. We'll put it right there, abc4.com/GTU. And that outpatient clinic, that CDH outpatient clinic, has a phone number that is right there on your screen. But go to abc4.com/GTU. And our thanks to Intermountain Health for sponsoring this interview. Thank you, too.
Thank you
very much.
By sharing the good news.